Cases of flu and the respiratory virus known as RSV are on the rise right now across the country and right here in the Central Valley.
Yeah, some doctors say this season is expected to be more severe than we've seen the last couple of years. Fox 26 reporter Sophia Lesseos breaks down what to expect with RSV and how to prevent it. Sophia?
Many kids are back in school without masks, and pediatricians say this may be their first time exposed to RSV. This could mean higher infection rates and more severe cases for those who catch it.
Because children have not been exposed to these viruses for the last two and a half years, and this may be their first encounter with some of these viruses, and that typically is a more severe infection for anyone.
Respiratory Syncytial Virus, or RSV, is a common respiratory virus that usually cause mild or cold-like symptoms. According to the Centers for Disease Control and Prevention, most people recover within a week or two. But RSV can be serious, especially for infants and older adults, and cases are on the rise locally. In 1 week, Valley Children's Hospital went from an 11% RSV rate to almost 20% of all kids tested. Last week, 8 children were admitted for RSV. Compare that to just 3 the entire month of September. She says if you're seeing these symptoms, it's time to go to the doctor.
If your child seems dehydrated, they're not drinking enough and not urinating enough, that is a concerning sign for us. And sometimes with breathing problems, kids don't eat and drink well.
Other signs to look out for?
Noisy breathing and coughing are expected symptoms with respiratory viral infections, but breathing very fast or breathing hard, so you see the skin sort of pulling in between their ribs, are more concerning symptoms.
Prevention should be something we're pretty familiar with, since we've been practicing these measures for the last 2 years.
Unlike COVID, this is primarily spread by touching, so hand hygiene really important. The mask is also important because after a child touches an infected surface, they then bring that finger, their hands to their mouth or their nose, and that's when the virus gets into the body and infects them.
Dr. Dahl said most cases don't need to come to the emergency room, especially since these are longer wait times in the ER. Unless you have an underlying health condition, you should go see your primary care physician. Liz?
Oh, Sophia, I know in years past, Valley Children's put restrictions in place for visitors as they saw the increase in RSV cases. Is that happening right now?
No, so not right now. They don't have any restrictions as long as people aren't showing any signs of sickness.
All right, thanks so much, Sophia. Sierra View Medical Center in Porterville announced that it is activating RSV and flu restrictions. It has stopped allowing visitors 13 and under as a precaution. Those restrictions, we're told, will remain in place until spring of 2023, at which time the hospital will reevaluate its measures.